Let's talk skincare.
Moxie was spicy.
I've had patients tell me they buy their stuff off of like Facebook group buys and things like that.
Botox?
Botox.
You should just be aware because you don't know what shit is going in your face.
No.
And it could literally be shit.
Get your lips done.
I've had a patient ask me if we did Botox in the sole of their feet.
Are we watching Love Island?
Yes.
I wouldn't sleep for 2 weeks after injecting someone with Botox because I know it takes 2 weeks to kick in. And I'd be at home like, they're not going to be able to see out of their left eye. I'm sure that,
I just got back from Miami and I saw some big Miami lips.
I don't want hair anywhere except for my head and my eyebrows. That's it. That's the only places I want hair.
Exactly.
So now you know.
Thanks.
Oh, timer's on.
All right. You girls ready?
Yeah.
Okay.
Ready as you'll ever be.
Yes.
We're here.
Ready? Action.
Oh, well,
Good
welcome
morning.
back.
Good morning.
So by the time this airs, like Meko and I will have had a 2-week break. We reposted our menopause episode with Ange, who you met because I brought her in. So let's get our introductions going so that we can get the conversation started.
Let's do it.
Okay.
So these two special ladies work at Glo Medical Spa, and they are both nurse injectors, RNs. This is Taylor Clemens and Hayley Smith.
Yep, that's
Sorry. And they are awesome. You two are a delight. All of our patients love you. We love you. The staff loves you. You guys are just bright lights. So anyway, want to introduce you because we are going to talk all things injectables, aesthetics, why we do it, why you shouldn't do some things, what are some new up and coming aesthetic procedures that we're bringing to Glo or that we love to do to help people reverse aging. Yes.
All right, well, here's a round of applause.
Yay.
Thanks for having us.
Oh my gosh, thank you so much for being here.
so many
Miko's
questions.
just getting us to cry really quick.
Oh, I love you guys. So from the minute I met both of them, I just knew they were just a connection that we had and that I knew they would fit in. And from day one, you both have been amazing.
We love
So-
working with you. So.
Oh, thank you.
Well, I would say that they are a true testament to when God closes a door, he opens a window.
Yeah.
And that at Glo, and that absolutely happened.
Yeah.
I think you guys are fantastic. I've had both of you work on my face and, shove needles and tubular things or whatever.
She's like, whatever you're doing.
Cannulas.
Yeah, that's what it is.
I don't know. I feel like on both ends, like it was, we were ready for a change too.
Yeah.
The stars aligned.
Yes.
Yeah, no,
Yes.
it's perfect. Yeah.
So tell us your backgrounds. First of all, tell us your backgrounds, and then tell us why you changed from whatever nursing you were doing to aesthetics, because that's a big change.
Yeah, it is.
And everybody thinks they want to get into it, but they actually don't know until they're into it, right?
It's true.
So yeah,
Go ahead.
go ahead.
Well,
Haley.
it's kind of funny because Taylor and I are super like intertwined in our
Yes.
entire nursing career, which is pretty rare. So I graduated in 2019 from Saginaw Valley, started in the ICU PCU combo unit in Elma, Michigan at MyMish. Was there about 3 years. We were through the heart of COVID. So we were
Hardcore
2019,
COVID.
2020, 2021 in a rural hospital. So it was heavy. I don't feel like we had a lot of experience under our belt to dive into something like that and coping with.
And they just
what we
threw
were
you
seeing.
right into it, I'm sure.
Yeah, I
'cause,
mean, you had
they-
no choice.
All hands on.
Yeah.
Yeah. So we went from like maybe a couple ICU vents at a time to being like an 18-bed ICU vent unit. So it was crazy.
And for those of you who know that town, it's a small town.
It is a
So
small
that's
town.
big.
Yeah.
That's
Yep.
a lot of beds
Yeah,
for that
it was
town.
a huge switch.
Yes.
So I feel like towards the end of 21, actually I'd gotten married that year, and I was able to take a month off because I had so much time saved up, and I was just like, I gotta get out of here. Ended up starting at another, actually a plastic surgery office. So I was there for almost 2 years, and there's just some management changes that weren't a good fit, and it truly ended up aligning with kind of when Glo had some big changes going on. So I've now been in the aesthetics industry injecting for almost 3.5 years. So it's just been cool. ICU is very close attention to detail. Aesthetics also is very close attention to detail. So there are more things that align than you would actually anticipate there would be. Sometimes I miss the like adrenaline rush of it, but people truly want to be in your chair, which has been a nice change, and we're people. So that's why we're in this industry.
Yeah.
Exactly. So like Haley said, we actually are intertwined because we used to work at the hospital together, which I feel like a lot of people don't realize, which is very exciting. So we've been together for a very long time. I graduated in December 2019, actually. So I was just like a baby nurse. Haley had been there for a couple months, and I had an internship at the same ICU, PCU unit over in Alma. So we lived through the trauma together. We trauma bonded for sure. Haley was the first to leave the hospital from us. And I knew I also wanted a big change too, working night shift, COVID patients. It was just a lot mentally. And so when Haley was over at the aesthetic office, she actually needed a training model.
I forgot about this.
Yeah, so the first time I went over to the plastic surgery office, I was one of her training patients. So I ended up meeting the owner at that time, and the owner was looking to hire a plastic surgery nurse. So I wasn't specifically on the aesthetic side right away. So I did the plastic surgery, like follow-ups with the plastic surgeon, and then slowly they integrated me into injecting. So we really have worked together for a long time, and we both left the same place at the same time and came over to Glo.
So I think what the misconception is that people think you go to nursing school to become an aesthetic injector, and you do not.
No.
You do not. You go to nursing school to become a nurse.
Yes.
And you work the floors, and you work, night shifts and all that kind of stuff to kind of get your sea legs, right? And I would say becoming an aesthetic injector, you have to have that under your belt. Wouldn't you agree? First,
I think it's huge.
It helps because
necessary.
when you're dealing with people who are coming in and they're paying cash for something that's going in their face, it's a voluntary procedure. They're pretty particular.
Yeah.
So you have to make sure you know bedside manners, how to handle all
Assessment
situations.
skills.
Yeah, assess it and like pretty quickly.
Yes.
And I think you both do that very well. So tell us about your training that you did for aesthetic training.
Oh yeah, good question. So I actually have patients that ask me all the time. We have quite a few nurses that are our patients. That's always
everybody wants to become an aesthetic injector.
They're always like, what did you do? So we didn't do like a specific, like they have like online courses now. They have weekend courses. Like I feel like everyone's trying to get like skin in the game because it's such a growing industry. We actually did, most of our training was on the job, but actually a ton of probably our favorite trainings have come from the products that or the brands that we work with. So Allergan and Galderma, am I allowed to say that?
Yeah, you can.
Here? Okay, great. They provide a lot of incredible training. So I would say probably about every other month, every 3 months, we will actually go to an in-person training. The apps have a ton on there. So we've worked with plastic surgeons. We've worked with nurse practitioners that have been in this industry for like 15, 20 years, and they've seen it through everything.
Yeah.
So I'd say those are the ones that have hit home the most, but we actually learned from a nurse practitioner and a plastic surgeon initially. Those were kind of our heavy training was up front.
And working on real patients.
Exactly.
So I've also been a trainee, is that right?
I'd say.
Trainee, right?
Model.
Model. Yeah. So when Randy worked for Botox back in the early 2000s, I started getting Botox as they needed a model too when he worked on the brand. So I saw the parade of nurses and doctors. I think I was injected by, oh my God, I don't even know, like so many different people that were training.
Yeah.
I'm not even sure my face was like even at some points. But so that's how you get to know a facial structure. I mean, it's very, very, it's an art and a science.
Yes.
Wouldn't you agree?
Oh, very
Especially the
artsy.
injecting. Yeah.
Definitely.
Because it's not everyone's face is the same. It's not a linear
Yeah, we're
piece
not
of
symmetrical.
paper. Right.
Right.
So nothing's symmetrical. To try to make people symmetrical is probably more of the art part, right?
Yeah.
Or because that's what people claim is beautiful, right? Is
symmetry.
Yeah. And so everybody wants symmetry. I mean, you guys can talk about this, but the lips, especially when people come in, they're like, oh, I have this lip that's bigger on this side. Can't you see it?
Yeah.
And then you're like, Okay.
Kind of.
Yeah.
I notice it because I'm an injector, but nobody else is.
Yeah,
noticing
exactly. Exactly.
Well, and the experience that you have as an ICU nurse is huge, right? Especially if someone, it's probably not typical, someone were to go down in a med spa office, but if it happened, good to know that you know how to handle the situation.
True, yeah.
You know, because people might just faint from the needle. I'm not talking about like an allergic
we've
reaction.
been there.
Yeah, we have been there.
For sure. But like how you talked about the fact in the ICU, those people had to be there and you had to care for them.
Yes.
And in a medical aesthetic office, they're coming in because they want this.
Yes. Right.
But now you're dealing with two different reactions, right? Someone who needs your care in order to get better, and someone, I mean, to put it bluntly, vanity is what's bringing them in there, right? And I am so guilty of that, right? But then you also have to deal with a different component where they can be, I mean, I know some of the ladies that go and get stuff done, whether it's at Glo or somewhere else. They're really picky and opinionated, you know? And I think both of you handle that very, very well.
Thank you.
I mean, I don't think I come in opinionated, but I know just your bedside manner with me that you probably handle those sticky situations very well.
I think it's
They're
we've
pros.
learned you up front.
Yeah.
You're like, oh, I know you see this.
Yeah.
We're gonna do our best. No one's meant to be symmetrical. You've seen those pictures. Ooh.
Yeah.
You've seen those pictures where they'll like line it up and switch your face is symmetrical, and you're like, that is weird looking.
Yep.
Like no one actually
Yeah.
wants that.
No.
So I think it's like the upfront being very realistic,
yes.
but that's taken us years to learn.
Sure.
So you should have seen us as baby injectors. I wouldn't sleep for 2 weeks after injecting someone with Botox because I know it takes 2 weeks to kick in, and I'd be at
You're
home like
thinking of them the whole time.
they're not gonna be able to see out of their left eye. I'm sure that it sticks with you.
Yeah,
Yes.
yeah, for sure. So speaking of that, what are some of the myths that you want to clear up when somebody comes in and they've Googled something? They're like, oh my God, I just Googled the newest, latest, and greatest laser CO2 under my eyes or whatever. I'm making it up.
Yeah,
But
that's a good
what,
question.
what's your response to that?
I feel like a big one, there's lots of myths and things. However, like some of the biggest ones is like you're too old for Botox or men can't have aesthetic treatments and things like that. So I feel like those are some of the bigger ones. Off the top of my head,
There's a lot of, I feel like it's a lot of fear based now more than anything because of social media.
I'll look
so.
fake. I don't want to look like
People are
celebrities.
terrified
Those
of
are good
filler
ones.
right
Yeah.
now.
Yeah.
Really?
Yeah.
Oh, yes.
Have you seen the MRIs going around that are showing filler that they might have gotten like 5 years ago? But so basically when filler comes to market, the FDA has to give a length of time. So if the FDA said this is going to last 5 years, I'm pretty confident it has to be pretty close to that for everyone across the board. So they give it an amount of time that is going to be for the majority of the general population that's getting it done. So when these people are seeing it on an MRI, they're like, oh my gosh, this foreign substance staying in my face. But if it's in the correct plane and it looks okay, it's not causing problems. Like as long as they didn't deal with any kind of like vascular event right out of the gates, like it's okay. But the internet has given it like this scary tone of like, oh my gosh, this is just floating around. And
what I feel like a lot of people don't realize is aesthetic treatments, they're not, especially Botox and fillers and injectables, they're not permanent treatments. We can dissolve them, we can get rid of them. With Botox, it wears off, so there's no permanent changes from it. So I feel like that's another thing too people have to realize is like we can dissolve them or get rid of them.
Yeah.
So.
Well,
That's
like
a
with
good
filler, don't you naturally metabolize that
Exactly.
out?
Yeah.
eventually there's some that it will stick around. They're seeing more of that because it is the hyaluronic acid that we utilize. There's other ones on the market. But there is now some studies that are showing it lasting longer. But I mean,
Isn't that a good thing?
you'd think if everything's looking
Get your
good.
money's worth.
Right?
I mean, I think
like,
a
"Can I
lot
have
of
that
that
filler?"
stuff on Instagram that I've seen anyway is perpetuated by physicians.
that
right?
aren't in the
Versus
industry.
That are not in the industry.
Yeah.
So it's like, I'm an ER doctor. And I just did an MRI in this woman's lips.
Yep.
Do you see that filler? That's been in her lips for 10 years. Filler does not dissolve. And so it's like that fear mongering that those people are putting out into the universe.
Yeah.
That people are like coming in, can you dissolve my filler? Oh my God. I mean, do you guys do a lot of dissolving of filler? Or is it more like, I mean, not from you, but they come
Somebody
in
else's
from
boo-boo.
But yeah, we'll dissolve
come
from
in.
us too. Like there's no shame in seeing like, oh, that did not turn out the way exactly how we wanted. We obviously want perfection.
Yeah.
Right.
So.
Yeah.
It's our art walking around. So I
Right.
feel like that's a good way to
Exactly.
look at it. And we're always very upfront and honest with patients. Like if you're getting filler, there is a high chance that eventually you will have to be dissolved or
Yeah.
you'll have to get rid of it, because over time, just even natural like movements or like the way that we talk, things like that, filler can move around.
Yeah.
So even if it's done by the best injector in the world, like it can still happen.
Right.
So
Right.
it doesn't mean somebody did something wrong. It's just the way it moves. So
Yeah.
Yeah, and I feel like we're big on saying no. Like if
Yeah.
if
Yes.
someone wants lip
Yes.
filler and they are migrated, like we will dissolve first, or they're gonna have to go find someone else to inject them.
Exactly. Exactly.
I just got back from Miami and I saw some
Oh, Miami.
big
Yeah.
Miami lips.
Yeah.
I mean, just so unproportioned to the face, right? I mean, just gross because it almost looked like it hurt.
Yeah.
You know, it was like they got an allergic reaction to their lips.
Yeah.
And they couldn't even eat.
Well, I
you
feel like
know?
their beauty standard is different.
Right, to
Different,
each their own,
100%.
right? But
Yes.
we're in the Midwest.
We are in the
Yeah.
We
Midwest.
try to look
Michigan.
more natural.
Yeah.
Yep.
You know?
Well, and getting back to your point, I think that's what people, when they Google stuff or whatever, they're like, I don't want to look like that. And
Yeah.
they think that every
100%.
injector is the same.
Yes.
And they're not. So just know they're not.
Right.
all
You'd
the
also
same.
need like 5 or 6 syringes to look like.
And that's
to
a
look-
lot of money.
Yeah.
Yeah.
Nobody wants
Yeah.
to pay that much
No.
money
Yeah.
at one sitting.
We
Yes.
want you to look natural.
Yeah.
Now, and I know I've totally done this, right? Is when there's something new I want to try, I will Google,
Yeah.
like the fuck ups.
Yeah.
Like
Yeah.
what is the
Yeah.
option that might happen to my face
Yeah.
if this goes wrong?
Yeah.
I do. And then I come in and Taylor
You're like,
normally
"Talk me
talks
down."
me down off a wall. And then my next question is, well, does Meko do this? And you're like, yes. I'm like, okay, fine, I'll do it.
Okay, I'll do it.
Just know I do everything.
I know. It's just helpful to ask.
Yeah.
I would get
It
a
does.
facelift if you girls did it.
I know every once in a while I
We
do
appreciate
this.
that.
Now, when you worked for the plastic surgeon, did you ever go into surgery with him, or did you do most like post-op?
Yep. So definitely when I first started there, he wanted me to learn a lot of
understand
like,
what it was.
yeah, exactly. What's happening to these patients, what the actual recovery process is like, what they're going through. So yeah, I luckily got to see a lot of the different types of surgeries. Now, once I became like more established and like more comfortable, I definitely did more of like the follow-ups
Okay.
and consultations with him. So that was really cool to see too. So being able to like tell my patients now, like, although I wasn't, the plastic surgeon or anything, I did get to see his like assessment skills. So I feel like that was really important to learn from somebody like him. I can be very honest with patients at this point and be like, you know what, like this is a lot of money. I would probably say you should go and spend your money on a facelift or something that you're going to get more benefit out of. Whereas like if we put all this filler in you or all this Botox, it's not going to give you the results you're looking
Yeah,
for.
right.
So I feel like that's really important, being able to, have that from him. So yeah.
No, that's great.
That's perfect because you don't want somebody to just be like, yeah,
Yeah,
for
let's
sure.
do it.
That's so unethical.
Oh, yeah.
We would never do
Exactly,
that.
exactly.
Yeah.
Well, I feel like what's huge with us too, especially being in a smaller town, like we're not just like a in and out.
No, we're not a
throw
Groupon
some filler.
place.
We're curating relationships
Yes.
at this point, and they
Exactly.
want
100%.
honesty.
We want you for a long time
Yeah.
or lifetime.
Yeah, exactly.
Yeah.
Okay, so what is the latest and greatest trend do you think is going on right now? Like, do you think it's because you had alluded to filler, less filler, people don't want filler. So what is the look?
Yeah.
Natural is
Yeah.
definitely
Yeah.
it. So a
Yeah.
lot of like
Anything regenerative.
regenerative treatments like PRF and Sculptra, microneedling, all of those types of treatments that were stimulating your own collagen production, I feel like are huge right now.
Yeah.
So
I agree. Can you get into those?
Yeah,
Like
of
individually?
course. Oh, yeah.
So PRF,
So that's
explain that.
platelet-rich fibrin. So that gets patients, a very specific demographic of patients
Yes.
get very jazzed about that one because we're literally putting nothing into the product that we're re-injecting. So we utilize PRF mostly for the under eye area because it doesn't have like a ton of support.
And can you explain how you get the PRF?
Yeah, so we actually do a blood draw right when they come in, and we spin it in our centrifuge. So I think it's for like 6 minutes is how long our spin is, and so it just separates the platelet-rich fibrin from the red blood cells. And we just take it. You only have a certain amount of time to get it injected before it starts to become just
solidified.
congealed.
Yeah,
You
exactly.
can't actually inject it that way. So yeah, that it just gets patients very excited because we're recruiting all these growth factors to an area without additives, because that's
Exactly.
the language that's going around.
Regenerative, I think, is so interesting because, like, for your under eye, I remember for years it was a big deal to do under eye filler.
Yeah.
And then everybody looked like they had ropes under their eyes.
Yes.
Right?
That's been poo-pooed.
Yeah.
There's very few
Patients
good
that-
candidates for under
Yeah.
eye filler.
So we typically recommend PRF at this point for patients,
Or start there.
Yeah, exactly.
So you inject it.
Yes.
Okay.
Yes. So it sounds kind of scary when you say
Yeah.
injected. We're not specifically putting like a needle right in the under eye. We actually use a cannula device for a lot of areas that are higher risk. So we actually will do one poke like towards the cheek area and sneak it in with basically like a straw-like device into the layer of tissue that we want it to be. And then we have low risk for any kind of vascular event that way.
And you're not bruising.
Yeah, exactly.
Which people, that's the more important part.
They're
for
like, how am I going to look
navigates.
tomorrow?
Yeah.
Yeah, you don't want to look like you have a black eye.
Right,
Yeah.
exactly.
Right.
But I will say, I feel like a lot of people are surprised by how quick and how comfortable the treatment is. Like, it's a weird area because we're close to your under eye, but they do so much better than you would ever think. And they're always like, oh my gosh, that was so fast. So it takes longer for us to draw your blood and spin it down to actually do the treatment.
Do you
Yeah.
see results right away?
No. So
Okay.
you see swelling right away, which a lot of people are like, oh, I love the look of this. It looks like filler. It looks like fresh, like added volume. But no, we usually always recommend patients get at least 3 initial treatments, 4 to 6 weeks apart. And then we're very honest with them. Of course, you'll probably start to notice a little bit of difference like over time, but probably the biggest difference is like 6 months down the line is what I always tell people. And you have to keep up on the treatments too. So like once a year or twice a year, like maintenance treatments. So
And what does it do,
yeah,
the PRF?
it's adding like it's re-stimulating growth factors, so it's stimulating fat cell regrowth. It's helping with like the crepiness, so that like thin skin under your eye. It's adding very subtle volume, so it's not going to look like overfilled by any means, because I think that's a big thing that scares people away from like any injectable treatment, is looking overfilled. And then it's also helping with like pigmentation too. So again, over time, as it stimulates the collagen and the growth factors, it's doing a lot in that area. So
That's awesome.
yeah, it's
So
a really
and
cool
then
one.
Sculptra's a similar thing.
That's
so
our
yeah,
fave.
yeah, you guys
That
have
is our
both
favorite one.
injected my face with that. Yeah. And then the third time I went in, like you had a hard time because I
did.
built up so much collagen,
I did,
which
yep.
you know, yeah,
felt
which
so
I mean
bad
is a
for
great
her.
thing. You know,
She did so well.
Make it less comfortable.
But yes, that's a really cool one too, because whereas PRF is where like targeting your under eye or like a specific treatment area that doesn't need as much structure, Sculptra is full face treatment. I should say from like here down. We can't treat your under eyes, we can't treat your upper face, and we can't treat your lips. But we can do your cheeks, your nasolabial folds, your jawline, your chin. So it's a really cool again, collagen stimulation treatment. It's a polylactic acid too. So, but
Yeah,
my
a little
favorite.
different that way. That one actually has some decent fear on the internet right now too, because there was a
Sculptra?
plastic surgeon
Yes.
that came out.
Oh, God.
So
What is he saying? What's the myth?
Yeah, so that's the
because let's
common
bust
thing.
it right
Yeah.
now.
Yes.
So we've had now sculpture trainings with one of our favorite plastic surgeons down in Greater
Yes.
Detroit. So we've asked him these questions. Galderma's done a lot of trainings too, interviewing plastic surgeons, what their opinion is. Everyone's worried, like, when you go to cut and do a facelift, do a neck lift, anything, if you have that sculpture in there, you're not going to be able to get through the tissue, do these things. It's the areas where they're working, like, yes, you have to get through that tissue eventually to get where you're going. Yes, but that's not the area where we're actually laying out the collagen, the Sculptra.
The Sculptra.
So that's been a big thing. And someone went online with one of these plastic surgeons, and it's permanent, and you don't want to do this. Well, we're like,
causing nodules.
Oh
And
my
like,
God. If it was
permanent
permanent, you
nodules.
wouldn't have to get it done.
right.
again.
And in
Yeah.
theory, whatever collagen and elastin stimulated, it's yours. But
Yeah.
we
It's
continue
your
to age.
own-
The product's not just sitting around in there.
Right. So Sculptra historically was used for AIDS patients.
yes.
Right?
Yep.
That's how it was invented for the gauntness
Yes.
for HIV patients.
That's one of my favorite fun facts.
Yes,
know.
it's really great. It's
Yeah.
it was like it's an old
So if
drug.
that tells you
yeah,
anything,
it's been
like-
around for this long. So
And now they've like rewritten how they want us to reconstitute it. So we use quite a bit more sterile water than they used to recommend.
Yep. And a massage
15 years
process,
ago.
too.
Yeah.
The
So
555.
there are risks. There's risks with anything, but we have the ability
Ways
to
to
go
treat
back and
them.
address
Yeah.
if you need
Yeah.
to.
You know, but then sometimes, you know, maybe that plastic surgeon just didn't do a good cut and wanted to blame it on something else and blame it on
Yeah,
the
you
sculpture.
never
That's
know
what
where
I'm
people
saying.
are coming from.
If he
yeah.
can put something out into the universe, so can I.
That's right.
The amount of
right.
patients we had coming in after that, though,
you serious?
that were like, oh, I don't want to do my last session.
Permanent.
Or,
Yeah.
And so
I'm
you had to.
scared.
So that's
Yes.
another thing about your job is not only do you have to
Talking
treat
people
the
off a
patient,
ledge.
yeah,
Yeah.
talking people off the ledge or talking them.
Re-educating.
Yes,
Because everyone's so educated.
Yeah.
Right. You
'Cause
can't go to
Instagram.
medical school on Instagram. Sorry,
Yeah.
kids.
Right.
You can't do it.
Well, and I even went in for hydrofacial or a diamond glow after like my third treatment, say like a month or so
Yeah.
after. And Jillian could notice the way that she like pulled the
That's
I
awesome.
don't know, or the tube of
Yeah.
you know,
Yeah.
the wand.
Your
that you
vacuum.
use.
Yes, the wand.
Yeah. That she's like, oh my gosh, she's like, your skin is so much firmer
Yeah.
than before, right? Because before, you know, you get old, like the skin's just
A little bit more
you know, and
lax,
has
yeah.
no elasticity to it. Yeah. So yeah, I mean, I'm chasing that youth stick like it's crazy.
hook me up.
Yeah,
Yeah, give me
exactly.
all
Me too.
the things.
What do you recommend as the earliest age to start injecting for
that's-
prevention?
that's a
Because
good
you ladies
question.
are in your 20s.
Yeah.
Yeah.
And you look fabulous. You look natural.
Yes.
You
Yes.
look like you should look. You
thank
don't
you.
look. The thing
Yeah.
that bugs me when I see some girls that are overdone, a lot of celebrities, is they get so much done that they actually look older. It makes
do.
them
Yes.
look older, and it doesn't make them look natural. So tell us what you think your recommendation would be to a younger woman that came in or older and had a daughter.
Yeah.
And what's appropriate age?
So I feel like that's kind of a hard, tricky question. I will be very honest, because technically, as long as you're over the age of 18, you can start receiving injectables. But everybody's anatomy is so different.
Yeah.
The way they age is so different. So honestly, if I start, I would say 18 if they have like signs of aging already. If I'm being very honest, which is very rare, obviously. But if we start to notice like static lines or like, you know, from sun damage, because we love to be tan in the
Yeah.
summer and things like that. Like I've seen some pretty young people have signs of aging pretty early on, to be honest. But usually I feel like it's usually in their mid-20s is
Yeah.
very standard
That's a
for
little more
preventative. Yes.
And
yeah.
I'd say confidence level plays into it too, right? Like
Yeah.
someone comes in and if I know that we
Yeah.
are heavy on education and
Yes.
if people ask our recommendations, like we do our best, but also at the end of the day, like you're the one that's looking in the mirror every day. Like what,
For sure.
what are you paying attention to? Like what's
Does it
impacting
bother you enough
Yeah.
to start treating
Because
it?
that's what we're in the
Yeah.
industry of. Like
For
we're just
sure.
building confidence. Like
Yes.
we're not looking to make you look like different people.
Yes.
100%.
Yeah, and I
agree
love
with
that
that.
about you guys because building confidence is probably the biggest takeaway that we have at Glo anyway for people to end up leaving with. And it's not, you're right, you want the person to look their best,
Yes.
whatever that means.
Yeah.
Right? So somebody could come in and like I mentioned before, like, oh my God, I hate this wrinkle. And you're like, bro, you got like
So much other
so
thing to
I
worry
mean,
about.
where do we start? But if that's what bothers them,
That's
and
what-
is going to make
yes.
it. Then that's what matters to
Especially
them.
at that young age too,
Yeah.
because you can start injectables and they can have, I mean, they could have static lines there
But if
for
they-
years,
yes.
but their skin's in decent shape because
Yeah.
they're young. So you can
Right.
get more impressive results than if you've got your 60-year-old that's never had anything done before
Yes.
that's coming in because
Easy-
their skin's not
yeah.
just going to bounce back.
It's easier to prevent than to correct is
Yeah.
what I always
For-
tell patients.
Definitely.
But another thing is I feel like a lot of people, when they come in, they just expect us to tell them exactly what they need. Or like, what do you think is wrong with my face? It's like, well, like you said, what bothers you?
Yeah.
Because I'm not going to tell you what I see necessarily right off the bat, because I don't want to give you a complex, or I don't want you to start looking at something that never bothered you before.
Right.
'Cause
Yeah.
You walk a tightrope.
Exactly.
Yeah.
It's one of those hard things.
Because they respect our opinions as
Yeah.
professionals. So
Yes.
we do like lay out care plans and have a game plan in mind.
For
but,
sure.
but you have to like
Tell me also
the
what
language
bothers
is
you.
really important
Yeah.
and
But you're both really good with, okay, so this is what you signed up for today.
Yes.
Tell me what you're looking to achieve,
Mm-hmm.
right? And then you can give the honest answer. Okay, well, maybe this isn't exactly what you should have signed up
sure.
for, Maybe we should look into that.
We've changed treatments.
Yes.
Yeah.
Yes. Oh, because I went from wanting all the filler around my mouth, right, to be as smooth can be. And you're like, no, this is going to change your face.
Yeah.
Let's start with Sculptra.
Yeah.
You know? And I think that's a good way to ease into it a little bit more naturally.
100%.
Although I'm totally fine with being a little full.
She goes,
fine.
Yeah. Okay. So getting back to PRF, so I get this question and I don't know how to answer it.
Yeah.
PRF versus PRP.
Yeah.
And why is PRF?
is it different?
Yeah.
It is different.
And so why is PRP or PRF now sort of the new buzz
Yeah.
Yeah,
versus PRP?
for sure.
So it's actually, so we worked with PRP in the past, so we were pretty well versed on that. PRFs, there's actually a few different options now too, because Easy Gel's even another option beyond PRF, but we don't need to dive too much into that. So PRF is basically a slow release of those growth factors versus PRP being like, boom,
Immediate.
growth factors release, done. Whereas for PRF, I want to say it's a week after treatment. The growth factors is at 5 days.
So why is that an advantage?
So basically, if you're having a slow release day to day, I mean, we have constant skin cycles, skin shedding. The skin is just it's an organ,
it's
right?
rejuvenating
So
all the
everything's
time.
changing. So if we have that slow release, we're going to be able to improve our skin even further.
And the nice thing about PRF too is this is just a little fun tidbit. It's just 100% natural. So whereas PRP we're adding like additives or like anticoagulants into it, whereas PRF it's just your own blood. Yeah, that's all it is we're separating it and we're using the good growth factors and re-injecting them.
And it's how much blood are you taking?
I feel like a lot of people are nervous coming in because
Yeah.
they're like, oh, it's going to be a huge blood draw, or I'm giving,
Do I have to fast?
Yeah,
No snacks
it's
required.
really not that much. If you, pretty standard. If you were to get like a couple like lab tubes done, like at a normal blood draw, so it's really not a lot.
And how else are we using PRF?
Ooh, we are, there's some exciting upcoming.
Yeah, let's hear about it.
Well, PRF is something that is amazing to utilize for hair rejuvenation. So, and men, women, especially. So, Glo I feel like we have such a big picture, exciting vision. Like this company is just incredible to work for. But with us doing so much with weight loss and hormone replacement therapy, I mean, you're going to see changes with the skin, perimenopausal, menopausal. You're going to see changes with the hair. Like everything that's annoying is coming with these changes as we age, right? So hair thinning is a big one. So us utilizing, Taylor and I have been researching like the best post care that we can utilize for that, but it'll be treated basically the same as under eye injections. Patients will come in for 3 treatments. They'll be 6 weeks apart, and it is injections into the scalp.
Okay.
Very, very small gauge needles, just like Botox would be.
So you don't need to numb.
We're gonna test the theory a
Yeah.
little
Don't
bit.
test on me.
We could.
I do
Yeah,
not,
that'd be great.
like around my hair is thinning.
I would think it would be a pretty similar sensation to
Yes.
like
To
forehead
Botox, like,
injections.
It's like,
Yeah.
But you're using that small of a gauge
Yeah.
needle.
So
Yeah.
we used to numb when we did hair rejuvenation for PRP back in the past at the plastic surgery office that we used to work for. So we would numb the scalp for like 15 minutes or so. However, we were adding stuff to the act, which would cause a little bit
was
of like
making it a little
painful.
spicier.
Yeah, more painful. So we'll kind of have to test out on maybe some of the staff like Meko and see what works best for us too, because it might not be necessary to numb the scalp, just because it can be a little messy, of course, with your hair. So
Yeah, and so hair rejuvenation is an awesome option, and we also utilize PRF post skin pen microneedling.
yes,
So you already have those channels wide open. So I don't know. We always refer to it like collagen stimulating inside out, outside in.
Skin pen is
Yes.
spicy though. Spicy.
Yeah, I didn't think it was too
I don't
bad.
think you know.
Am I thinking the wrong
You're
thinking
thinking
of
of
Moxie.
Moxie?
Moxie was spicy.
Don't tell the people.
No, but it's okay because you know what? You
They
need to
gotta
be
know
warned
it.
because Miko's like,
but it's worth it.
It's fine.
It's so worth it.
It's
though.
so
It's so worth it. But I feel like Meko is the bionic woman.
Yes,
Where things
she
just
is.
don't phase her.
She does really good with the
Right?
Moxie.
Yeah, don't ask our front desk worker either, Tracy.
Yeah,
These
Poor
two,
Tracy.
they're like nothing.
Right?
Yeah,
feel
well,
pain.
so, what am I thinking of? Not if it's not maybe Clear and Brilliant.
Clear and Brilliant's also pretty
Yeah,
spicy.
I wanted to like.
Same.
I think I had it done in the wintertime. I wanted to put
Yeah.
my face in a snowbank.
Yes,
It was on
You say skin
fire,
pen? I don't- when
but
I
it
had
goes
done,
away
it wasn't
pretty
too bad.
fast.
Yeah, it
but
does.
it's just that moment where it's like,
Yeah.
woo! Yeah.
Nope, I hear you on that. I haven't been a brave girl since having our little guy. I still haven't had a Moxie yet.
You haven't? Oh my God. Okay, let's talk about Moxie. That is my new favorite treatment. I get it. What do I get at you guys? Like every 6 weeks?
Oh, it's
probably
she
so
loves
much.
it.
I love it. I get like a hydrofacial.
Your skin looks amazing
It is.
right now.
Yes.
Thank you.
Her skin
And I
is
don't really wear
glowy.
that much makeup anymore.
Yeah.
I used
That's the
to
dream.
more, but like I just wear like a sunscreen and whatever. And I love it just because it makes the tone and texture just like, I don't know, magic eraser for the face and neck and chest.
Yeah.
Yeah.
So we're obsessed with Moxie.
Yeah.
I feel like it filled a whole. Saitan is the owner of Moxie. I have a lot of respect for their technology and their lasers that come to market, and it takes a long time for them to bring what they bring to the market because they're making sure that they're adding a tool to our toolbox and that it's going to be effective. Moxie filled a laser hole for that company where basically we can go after a skin condition called melasma. So that's a hormonal pigmentation of the skin without heating it up to a point where we're potentially exacerbating it or making it worse. So that was basically an area that there's just nothing on the market that quite did it. Clear and Brilliant was a good option for it, but didn't quite get as aggressive as some people are wanting to get. So it filled the hole for melasma treatment options as well as a hole for how can we laser in the summertime. So you can safely get Moxie laser treatments with some tan to your skin, whereas with like Hale, which is a bigger, heavier hitter from Saitan, you can't have tan to your skin. BBL, no tan to your skin. I'm pretty sure Clear and Brilliant, you can have some color to your skin as well. But yeah, so it just gave us a safe, effective treatment where we don't just say like, I guess you're getting hydrofacials all summer, so we can actually strategically and safely do some laser treatments all year round.
No, that's great. Is there anything that you might be putting on your face before a Moxie treatment that you should stop a few days, like in advance?
Yeah,
Like a retinol?
in theory.
Yeah.
Okay.
I feel like it just depends how crazy you're feeling. Like
Yeah.
we recommend typically like 1 or 2 days before you can stop your retinol.
Okay.
I'd be lying if I said I always stopped retinol
never
before my
stop
laser
it.
treatments. It's not really my
don't
jam.
I
stop it
forget.
either. Well, sometimes it's a spur of the moment.
It's a spur of the
treatment.
moment. I'm like, oh, you have an opening.
Yeah.
All that to say, you will be okay if you don't
Okay.
stop. And if
Yep.
you're on medical grade skincare already leading up, like your tissue is going to be ready to heal from something
Okay.
like this. So
Yeah.
it's going to be okay. I wouldn't use it right after your Moxie though, because that would not feel great
No.
that evening.
My new favorite pre and post is nectar.
Yes.
So
The Elastin Skin Nectar.
Elastin Skin Nectar. I don't even know what's in it. What's in it, girls?
So it has like a trihex technology, which is really cool. So it's something specifically that Elastin has patented. So what it does is it helps turn over old collagen and elastin and stimulates new collagen and elastin. But it's a really good like pre and post care product that is specifically made for like laser. It helps you heal much quicker. It helps your skin kind of get back to its normal baseline, I guess. I should say.
Yeah, just healthy.
Yeah. So
Yeah.
that's a really cool new product that we offer at Glo.
Well, that's cool.
Again,
Yeah.
like fill the hole. Like
Yeah,
we
exactly.
needed-
We didn't
needed
have
a tool for perfect
yeah.
post care, and Elastin really filled that for us.
Yeah.
Well, that's fantastic. I
Yeah.
haven't even heard of this.
You
I
would
need to
love
sign
it.
up for
I
all
guess
this.
you gotta have a
And
Moxie
get-
again.
Yeah, I gotta get
Yeah.
the Moxie and the
Get the
Nectar.
Moxie again.
I know. Do you have a link at Glo that if people, obviously they can't come into Glo for a Moxie because they don't live around here, but they can buy the nectar from you? Is there like a link to do that?
I don't think Elastin's
We can
on the
send it to you.
website quite yet.
Yeah.
Okay.
Yeah.
We'll figure it out. We'll give you
figure it
the
out.
411
We'll figure
so
it
you
out.
can
But
get it.
if you don't, if you don't live around here and you want to get a Moxie, definitely get a consultation first, right?
See if you're a good candidate for it.
pretty universal for everyone.
Yeah.
Yeah, all skin types.
All skin types, which
Yeah.
is also another key
Yeah.
point.
Yeah. So what
And
are-
you guys do your consultations for free, right?
Yes.
Yeah.
Yeah.
So, because I mean, women in my bar classes will be like, okay, well, I know you go to Glo. I want to know all the things that you do. And I'm like, well, I could tell you everything that I do, but you need to go there and you have someone who has way more knowledge scientifically than I do about what your skin needs are.
Yes.
You know?
Yeah.
Well,
So-
and everybody's skin is different.
Yes.
And you can't just, it's like hair. It's like going to your hairdresser and going, I want her hair. Well, okay, she has blonde hair and has a different texture and whatever. So it's the same thing with skin.
Exactly.
Is there like any type of celebrity right now that somebody would walk into your chair and sit down and go, I want what she has?
Celebrity, I feel like it's usually a little bit the opposite.
Yeah.
Oh, really?
Yeah.
You think it's just somebody that they know in town?
No, like they'll come and don't make me look like that.
Oh,
Yeah.
I got it. Okay, yeah. Okay, name a celebrity.
My favorite was someone, I have quite a few male clients, and one specifically was like, I don't want to, is it Ryan Seacrest?
I get
He's
him
like,
a lot
I don't
too.
want to look
Ryan
like Ryan
Seacrest?
Seacrest.
I've
Isn't
had
that
him
funny?
multiple times.
Can someone look
Yes.
up a picture of that man right now?
Can we get a current picture of Ryan
Ryan
Seacrest, please? They'll pop
Or
it up on the screen.
is it like Zac Efron? I mean,
Oh,
something.
I've never had
something
that one.
happened.
That's gotta be
like he
CGI.
has, like-
Is there something weird going on?
Something happened. He's turned into the Incredible Hulk.
They say
Right?
he
Like
car
facing
accident.
up.
There was
I
that
don't
movie
know.
with Nicole Kidman where, see, I don't think Ryan
I think they didn't want to be like frozen and look like fake upper
I mean,
face.
I can get
But
that.
he still doesn't look as crazy.
I don't think it's
No.
crazy.
I don't think it's crazy.
I've also had Willie Nelson. Is that am I
They don't
thinking
want
of
to look like him, or they
Is that
do?
the right Willie?
I don't know about Willie Nelson, but I
Nelson's
can see like
95.
back in the day, like Kenny Rogers. Okay,
Oh.
facelift was and the
I
filler
think
was
someone has
overdone.
said Kenny as
Kenny
well.
Rogers
Yeah.
Maybe
was
that's
scary
Yeah.
when he died. I mean, he had upper and lower bleph.
Yeah.
Clearly. He had
Yeah.
a facelift. I don't even know what else he
Yeah.
had done, but
Like,
he
at a
did not
certain
look
point,
like
man.
himself.
Yeah.
Yeah, I think Ryan
think
Seacrest
he
looks
looks
great.
great.
That's so.
Okay, well, guys, goals.
Yeah.
Apparently. I know. I think they were so worried. Well,
That's funny.
Clearly,
in
I've
general,
had
they
somebody say
don't
too,
want
though.
anyone to notice. And I feel
Yeah.
like you could
Right.
look at Ryan Seacrest and say, oh, this man has a face full of Botox.
Well, yeah, because there's not a single wrinkle.
Nothing's
in his
face.
face, right?
I mean, you
Or
can say that about
still
Randy
kinda wanna
Price.
look natural, but you just don't want to look as old.
Yes.
right. And
Yeah.
I'm sure that's for women
And that's the
too.
biggest fear, right?
Yeah.
Yeah. So talk to us about how you treat men.
Yeah.
Definitely way more units.
Oh,
because
really?
they're
Most of the
their
time,
face is
yeah.
bigger.
Their
And
muscles are
stronger
stronger,
muscles.
and we don't have to
I know, but have
worry
you
about
seen the size of my forehead? I mean, I have like 3 foreheads.
Oh my gosh, no, you do not.
No, you don't.
You get a standard amount.
Yeah. I feel like I have quite a few
does.
men that I had inherited taking over some patients, and I have a lot of couples that come in, and those are always my favorite days. But I have a man. It took me probably a year and a half to figure out his dosing because you're seeing them every 3 to 4 months.
Yeah.
If you're a busy enough person. We do, I want to say 40 units between his brows. Like it's just
So for reference, how many? I get like 10, right?
Yeah, you get a pretty minimal
I
amount,
get
maybe
like
12
16
units. Yeah.
between my
40.
brows.
I get
Wow.
yeah, like
Good
8.
luck.
And that's not the norm. Like it took a
Yeah.
really long time, and I'm tiptoeing, right? Like I was pretty
Yeah.
new at
Yeah.
this time figuring it out. But I don't know. I feel like men, like it takes a little bit longer to curate the relationship because most of the time
Yes.
they're not yappers like we are. So
Yeah.
we gotta.
That's
They're just
True.
like, and they're always like 8 o'clock appointment.
Yeah,
Oh,
get
yeah.
me in, get me out. Don't want to
No,
know.
that
Strictly
is
business.
so
I'm going
true.
back to
They're
the
about
work
the
site right
earliest
after.
Yeah.
Yeah,
appointment.
yeah. But they needed it. I mean, it is.
They
it
probably
works
wait
wonders.
longer to get
They
started.
do.
Yes.
too.
They probably start, I would say, in like their 50s.
Yes.
Is more average for
Yes.
men, whereas women we start to see more on average like 30s and
Yeah.
40s.
I think
Yeah.
I was 36 when I started getting Botox.
Yeah.
And I probably should have started getting it way younger because I had very, very deep lines. But it's hereditary.
you're
right?
good.
Yeah.
Yeah,
Yeah.
your
You're
skin
So,
looks beautiful.
yeah.
Yeah.
Well, that's because you guys take care of that. But yeah, I have pictures at a friend's wedding where I'm 32 years old and my skin looks more haggard at 32 than it does at 44.
Isn't that
You
crazy?
know?
Yeah. It is funny. You can reverse it. Mm-hmm. You can reverse it. Mm-hmm. Yeah. So for men, when they come in, do they want a consultation? What's the process?
Some of them.
Yeah, some of them do, and some of them are just like, I want something to fix this.
They don't
or-
want to hear about skincare
They-
a lot of times. They
no.
don't want to hear about lasers. They're like, what can be my quick fix and let me get on
Okay.
with life.
Tell them about your patient the other day who was like, I'm just going to keep tanning because I know you can zap.
I think I know who you're talking about.
Troublemaker. So
Yes.
he's
Yeah.
been a very regular Botox patient for me forever, and a sun lover, boat lover, and learned that you can do just like
BBL.
BBL spot treatments and
to get rid of
things like
sunspots.
that.
Yeah.
Yes, and so we had done one just as an add-on after our last treatment, and this time he came and I have 2 more, and I go, okay, but we're headed into 4th of July weekend. We're super diligent with sunscreen, like those could come back worse for us. He's like, what? Sunscreen? He's like, I'll just have you zap
Live
him
it
the
off
next
next
time.
time.
I was like,
That was his
Oh,
solution.
my
That
gosh.
is a man.
Yeah,
That's
that is
amazing.
a man. Yeah, for sure.
Amazing.
Not
Were
be
you like,
preventative.
Okay.
Well, you just
No
there's certain
promises.
personalities where you're like, you just learn to pick up like I'm not gonna push, or
Right.
as
Sometimes
long
you
as
just
I
have to
laid the
acquiesce.
education
Yeah.
out, and it
Yep.
is what it is.
Exactly. That's awesome. That is funny.
Like
that
I'm gonna hold the
men-
BBL handle hostage. For
Yes. That's funny that men don't want to do any skin care. They just want it.
I wouldn't say as a whole,
No?
but
Most.
Well,
My
a lot of
husband
ones we see.
was really against skincare or doing anything. And then we were at dinner with one of our friend couples, and he found out that the husband of the other friend was doing skincare. And the
Was
next
it Haley's
day,
husband?
oh, it actually wasn't.
we're lucky if Brandon washes his face.
It actually wasn't. But he found out our friend's husband was doing skincare, and the next day he wanted to start using all my products. So
They just need to know
I
they
know,
have a Conrad
it's
in
true.
arms. I think
That's
that's
right.
all it is.
See,
I'm
we
like,
need a
I could've
male
talked to you and myself.
guy at Glo.
A male guy.
Or a male, a male.
Yeah.
That can be our spokesperson.
Yeah, I
For all
agree.
things that guys do.
Yeah.
But you got to find someone like from a construction site, right?
Yeah.
Yeah.
Okay.
That's like,
Who
you know,
needs-
I feel like so many
Burly.
of my patients are.
Yeah.
They're like,
true.
you're
But
not gonna
but
bruise me,
why-
right? I'm
not
going back
only
to
are
work.
we in the Midwest where even the women are super secretive about what
Yes.
they do. I mean, that's why you don't have a Real Housewives of Chicago in Detroit, because, you know, they're going to be the last ones to want to put everything
Yeah.
out there.
Yeah.
But, you know, but then you add a Midwest dude on top of it. Yeah. No. In the vault kind of a thing.
In
I
the
know it.
vault.
I know it.
Yes.
Yeah.
It's
Yeah.
great though. I think it's an untapped market.
It is an untapped market.
They're
true.
like my
It's there.
favorite patients.
Yeah.
Because, like some of these men that come in, like I know what vacations they're going on. Like they're wonderful. They're lovely to work with. I'm like, tell your friends, like it's okay.
yeah.
And it is a confidence booster.
It
I
is.
see it too
Yes.
in other
Yes.
people. I mean, even just for my own husband, you know, like he'll be like, oh, I need to get, you know, something done or whatever. And I am trying to influence the next generation. So my daughter's boyfriend had a skin analysis done.
Amazing.
And he showed me a score, and I was like, "Oh, Zach, you know better than that." So we have him on. He's been to Glo a couple times and had a couple skincare assessments, and then we have him on a skincare regimen.
Oh,
So I'm
Good
trying
job,
to
buddy.
influence the next generation
Yeah.
of male that it's okay
Yes.
to
Take care of your skin.
It's
You'll
not-
thank yourself. You
Yeah.
really will. Even if
Yeah.
it's just skincare.
Right.
Skincare is amazing. It does wonders. So
It's the biggest organ
it's
of
the
your body,
insurance of
right?
all the treatments you get done.
It is
is
your
what I always
business
say.
card.
Yeah, exactly.
Yes.
All right. Haley, what's your favorite thing to get done at Glo?
To get done.
That's a good
Like if a
question.
spot opens up and you get to do something, you're like, sign me up right now.
Like to receive.
Yes.
I'm such a basic girl. I love a dermaplane, and I'm not convinced anything feels as good as a derm, except maybe a Lisa massage. That's definitely
Okay,
yeah,
that's definitely up there.
Yeah.
But that's more of a the stars really have to align
Yeah.
for
Yeah.
that one. But yes, a dermaplane, especially for my skin. So I've dealt with a lot of crazy changes postpartum and then post nursing. I'm an acne girl. I'm clogged through and through. Jillian tells me that all the kids are clogged on the water slide. We're out of water. They're just sitting in there. And I was like, that really hits close to home. I can feel them.
Yeah.
But yeah, she'll go in, do my dermaplaning, because nothing makes you feel like you're getting your money's worth from your skincare products like a dermaplane. I'm like,
so true.
it's getting
Yeah.
everything is getting in there. And then she'll go through and do all my cute little extractions. So I always look a little hit after, but if the dermaplane itself feels so good, and I feel like gives me bang for my buck, and I'm a skincare junkie.
Yeah.
So I think that's why I'm obsessed with that one.
Yeah.
So I know
No,
it's so
agree.
simple, but
Yeah.
Okay. Taylor, what about you?
I agree with Haley. I feel like I'm a little simple too. Honestly, if something opens up, I'm more than willing to get a hydrofacial. Like that is probably one of my favorite treatments. Your skin just feels and looks so good afterwards, and I love that. Like I know a lot of people don't, but I love that sticky, like dewy feeling afterwards.
Yeah.
So that's probably one of my favorites
You
to
just
get
feel
done.
so clean.
Yes,
Yeah.
yes. I'm like, oh, it feels like she said, your skincare just
Yeah.
goes on better. Your makeup goes on better. Like you get compliments afterwards.
Yeah.
So
Oddly enough, and I think maybe this is from Sculptra.
Yeah.
Prior to Sculptra, I would get a hydrofacial done with dermaplaning, and I almost would look like I got done doing like a super intense workout. I'd be super red.
yeah.
And I didn't have those after photos like I look so glowy.
Yeah.
La, 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 la.
Yeah.
Right? I look like I got beat up basically. But now I do look glowy. And do you think it's just my skin just like reacts better and it's just a little bit more youthful from the Sculptra?
I feel like it could be a little bit of both.
Like just an improved skin barrier, probably.
Because it is. It's helping your skin quality over time with the Sculptra.
Because I'm talking like major change. Like I couldn't be an after photo girly prior to.
I agree with you. I used to be I still am pretty red afterwards, but like, I agree. I feel like the Sculptra is awesome.
But I feel like by the time I get in my car, I can take an after photo.
Yeah.
Where like before I would have to take an after photo like 6 hours later. Right? But I just think because my skin was just so raw. I don't know. Just different. It's just totally
the integrity
different.
of your skin is
For sure.
It's
For
better.
sure.
I like that.
Yeah, you
Integrity
healed it
of my
right up.
skin.
Yeah.
Yeah, it heals up faster. And it tightens up quicker.
Yeah.
Okay, so let's think about Hollywood faces because we were just kind of on that.
Yeah.
Who are we liking for their face that you see on screen that looks natural?
Anne
but
Hathaway.
right, Anne Hathaway.
Always gorgeous.
Yes.
Yeah.
I feel
5
like
stars.
whoever her injector is, her lips are always just chef's kiss. They're
Yeah.
perfect. They're never overdone. I'm like, she has to be getting something in there.
Well,
Yeah,
she
she's
looks
in her
like-
40s,
yeah,
right?
she's my age and she looks 22.
She looks
She
like
looks
she did in
fantastic.
Princess Diaries.
Yes.
She's the same.
Yes, she like Taylor Swift is mine. Because
I
like
love
what
Taylor.
is she doing? Like her
Yeah.
makeup is everything is like she looks better now than when she did when she was 18.
She still needs help with her hair.
She's got naturally curly hair.
I feel like she doesn't
when
play
you got
into it too much these
No. It
days.
used
She
to
went
be
to
like-
a bob.
Yeah.
I don't know. I'm a big Taylor girl though because she's not like listening to what anybody else is. She's just
No,
like,
she
this
just does
is-
her.
This
Yeah.
is the space I'm in. This is how my hair's feeling for these few months.
Yeah.
Whatever, I guess.
Exactly.
Oh, well, let's dish on this for a second. How do you feel about her bestie, Blake Lively, bringing her in and trying to subpoena her and get text messages? How do you feel about that?
I used to really like Blake Lively, and I don't.
It ends with us. Is
Yeah,
that
I've
the-
heard all of this
The demise,
craziness,
the
and I'm
beginning
not
of the
gonna
end.
lie, I used to have a crush on Ryan Reynolds too,
Yeah.
and it's kind of went downhill after everything that's happened. Like,
Yeah.
I don't think they're even friends anymore, are they?
No.
I mean,
could
to
you
Yeah.
people like us, no, they're not. You don't know if they have to play
That's
it that
true.
way
Some
in the
silliness.
spotlight. You know, because there was also a publicity stunt where I think Ryan and Blake's baby is bigger now, like almost toddler age. And they had like an infant stroller walking the streets of New York City, pretending like everything was fine. La, 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 la. We're having an iced
Oh,
coffee
I saw
in the
that
stroller.
too. Maybe
I
it was
didn't
their
see
dog.
that.
And they're like, their baby is not in that stroller.
Right.
It's too small. So
Right. That's
I love that. I did not see that, but
Yeah.
I did too.
I don't keep
They're
up with
all
that
dressed
stuff
up
too much.
and stuff.
Yeah.
It was on
Oh,
Instagram.
I'm obsessed. There's this
Katie's
guy.
like, let me tell you about it.
I'm so obsessed. So there's this guy called No Filter Zach on
Okay.
Instagram and TikTok, and that's where I get all my 411. so if he's dishing it out,
Yeah.
I'm taking all of it in.
I love
And
that.
he's also someone. His skin looks like it's porcelain. Yes. Can you Google No Filter Zach like on Instagram or TikTok?
I want to see what he's
I know.
got.
I mean,
no
you look
kidding.
at him and you go, you get shit done. Like it's not supernatural, but at the same time, I'm like,
What do you
Well,
think the
it's
goal
nice.
is? Do you think it's to preserve how you currently look, or is it to reverse to a younger you? Like, what would you say to a woman who came in, or a man, who was like in their 40s, never had anything done, but said, I need to improve. What do I need to do?
Yeah, I don't think you're trying to send them back in time. I think the issue is when we age, internally we don't feel older,
Yes.
but our outside's not matching our
Yes.
inside.
Yes.
So I just feel like
give that confidence.
little
and
baby improvements of anything.
aging
like,
more
yeah.
gracefully for sure.
Yeah.
Like
Yeah.
maybe
Just
not
slowing
to
it
stop
down.
Yeah,
Yeah.
slow it down for sure.
Right.
For
Because
sure.
everyone wants to look like themselves
Yes.
still.
Well,
That's
and you
the
want to
biggest
look
thing.
like you feel.
Yes.
You're right.
Yes.
That is such a good way to put it. So when people want to come in and say they want to look younger, they just really want to look like they feel.
Yeah,
I'm sure.
that was a
right?
great way to put
Yeah.
it. I agree.
Yeah.
Yeah.
And so helping with, weight loss, hormone therapy, whatever it may be.
Yeah.
Yeah.
And then topping it off with great skin is
Yeah.
just like, finally, I look like I'm 35, like I feel in my
Yeah.
head,
Yeah.
Yeah.
Exactly.
And I think because you offer all of that at Glo, right? If someone's going downstairs to Glo Body and, you know, they are experiencing weight loss and like they feel comfortable in their body again. And, you know, maybe they're on the hormones and they're like, okay, my brain is starting to match up with everything else that's going on. You kind of want to look in the mirror and feel that comfortable and confident as well. All right. So here's no filter Zach. So, I mean.
Oh, yeah.
Yeah.
Oh, he looks like he'd be a character, doesn't he?
Yes.
He has a filter. No filter Zach has a filter on his
Yeah,
face.
he has no verbal filter, but for sure a filter.
For sure.
Right?
Oh my God.
Oh, speaking of P. Diddy,
skin
how
does
do you
look good,
feel
though.
about P. Diddy
I'm so
getting
pissed.
not guilty?
Well, on the most important counts, he did get guilty. He probably will serve less than 10 years.
Yeah,
If
this
for
is actually
prostitution.
crazy, though.
It's actually
It's really
a
sad.
sin. It just proves that the jurors that
Were
were
bought.
chosen were
Yeah.
just inadequate. Like,
Yeah.
what are they doing? How it's like
agree.
letting OJ off. He killed 2 people.
Yeah.
Diddy beat the shit out of that girl, and everyone saw.
Yeah.
And
It is crazy.
It's just disturbing. It's disturbing.
But that obviously, like a Joe Schmo is not gonna get off.
Right.
Yes.
Right.
Right.
Oh,
Yeah.
no, he's connected to
bought and
powerful
paid for
people.
it.
Yeah.
Yes.
Oh, for sure. For
Yes.
sure.
It is. Oh, I was so upset.
I agree.
I'm sure everybody is. I just can't.
I
even
couldn't believe it. I was shocked. Blown away.
Because, like, on that note,
On that note, how do you think, because everybody is doing supplements and vitamins and collagen and creatine, how are all of those things affecting our face? And we do them at Glo. I mean, we do the injectables, we do IV infusions. How does that all play into our skin?
yeah. I feel like I'm a little bit of a conspiracy theorist with some of the things.
Tell us. I love a good conspiracy.
Well, I like because Taylor and I have obviously dove into like what we're providing. And that's a big thing for us. We want to be able to answer questions, be sure to tell people like, look out for this. Like if there's anything that could possibly go wrong. I feel like it's a big thing in general to be just like selling these life-changing things online and influencers making a boatload of money on just expensive pee. Like I just feel like we're peeing everything out anyways for the most part. Like I do remember during COVID specifically, we were giving doses of vitamin C that our bodies physically can't even absorb, but everyone just didn't know what to do. So that's what you were doing. So I don't know if it's having even a big enough impact to be worth even discussing like what it's doing to your skin, I guess. But I might be not within the majority. Like I love it. I just feel like it's an easy way to sell something.
Okay.
No, you are entitled to your opinion.
That's
and
where
maybe
I'm
you
at
just
with
didn't
a lot
find
of this stuff.
haven't found something that works for you.
Yeah.
Too. You know?
So yeah, the absorption versus like an injection of a vitamin versus an oral.
Just an
Is that what
oral.
you're talking
Yeah.
about?
Yeah. Well,
That's what
so
I'm
much
meaning.
stuff is killed by the acid in your stomach.
That's what I'm saying.
Yeah.
I just feel like there's a lot of people making a lot of money on
Yes.
something that's probably not having an impact on
Yeah.
your skin at all.
Right.
Yeah.
What about the injections, vitamin injections?
I mean, it's all in how you absorb it. So
Yeah.
I think that there's definitely more to be said about that. But you can also get like a B12 shot at your doctor's office. I don't know. I just have a little bit more trust for that end of things.
Injectables.
Yeah.
And I feel like a lot of patients really feel like a big difference on the injections that we do weekly for them. We just started doing NAD plus, which is super exciting. I feel like that's a big one right now, like in the celebrity world and everything. And of course, it's still a little early to tell, but I feel like we've had a lot of patients who are feeling really good on it. Because if you think about it, someone put it like it's like internal red light therapy, so it's helping with like the internal things. So I don't know. I feel like it just depends on the person for sure. But we've had people say that they really love injectables for
So
sure.
for
like
the
vitamins.
NAD, are they coming in just getting a shot weekly, or
Yep.
are you sending them home with like a vial themselves?
No,
Needles?
we're
Oh,
injecting them weekly.
Okay.
Yep,
Yeah.
in person. So, and usually people don't have an issue with that. It's a quick appointment. They're here maybe like 5 to 15 minutes. So it's very easy. So people do very well with it.
And
It's
I
not
think it's
painful at all.
being tolerated really well.
Yeah,
At
yeah.
this point. It's new to us, but
Yeah.
I mean, I've had one.
Oh
I feel
yeah,
great.
people are doing really
Yeah.
well with it. So
Have you guys had a shot yet?
I have not. I'm a little bit of a sissy though.
Yeah.
So
Okay.
usually-
Haley did one on me because I won't poke myself. I'm not gonna lie.
Really?
I'm kind of
Oh yeah, we don't
baby.
poke ourselves.
No, we poke each other.
Okay.
Yeah. I don't know. I'm just kind of a wuss.
So you don't touch up yourself?
Never.
Okay.
Never.
No.
Which I think is a good thing.
I was just about to say, I feel like there's something to be said because there are people out there who inject themselves, and I just feel like I don't know how you could do that.
And I think you can gain a blindness eventually to it
sure.
too.
Yes.
Like, I don't
Yeah.
know. You
I
could
have
keep
her
adding
to
more.
sit there and tell me like, no, you don't need that. You are overthinking it. Like, so.
Yeah.
But yeah, so I've only
you're a
had.
good friend.
I'd come to work with my eyes shut if I was injecting myself. No one wants that.
I know,
How do you
I
do that
feel like-
backwards in a minute?
Yeah,
Exactly,
I don't know how you
exactly.
do it. I don't
So-
know how you do it.
I don't know.
I just heard this rumor, and you guys can tell me if it's true, that there are people that, people have these injectable Botox parties, which I don't even know if it's legal in the state of Michigan, honestly. I know I've been confronted by some people who are like, will you do one?
Yeah.
No, we will not. Just to be clear, Glo will never do a Botox party at your house.
You can come
First
right
of all,
in.
Yeah.
it's not sanitary. We
Yeah.
don't know what your conditions of whatever. Anyway, for so many reasons. But this one person was saying that people are getting injectables from Lord knows where because you have to have a medical license to actually get the
I
right
have a lot
kind
to
of.
say on all this.
Yes, let's hear it. Let's hear it.
Oh, God.
And they're giving it to people in vials and letting them inject it themselves. So
I
what
know.
this person was saying, it was online, they were saying that they were like, we're friends.
Yeah.
And you'd be like, well, I think you need Botox here. So they're taking that little white thing, marker,
Yep.
and marking everywhere they think they need it. And then they're just injecting it. Like it's just superficial. It is not, friends.
No, it can go
Botox
in.
is not. So let me know your opinion.
Okay, well, they're too young, but you remember Nip Tuck, which, by the way, that guy just died.
Christian.
Yeah. But in one of the earlier seasons, it was based in Miami at first.
Yeah.
And women would have Botox parties, but then a bunch of like the maids of the different like residents in this like neighborhood dressed up in their owners' fancy gowns and had this plastic surgeon who I think lost his license. So he got filler Botox or whatever from Tijuana and injected all of these maids, and their faces got like all fucked up. So that's what I think about when I think of turning a Botox party into a Tupperware party.
Yeah.
Okay, but now go.
Just like dive into it.
Gosh, so this wasn't specifically a Botox party, but hearing you guys say they're just buying it from willy-nilly, I've had patients tell me they buy their stuff off of like Facebook group buys and things like that.
Botox?
Botox.
Shut up.
And they're injecting themselves. They don't have any medical background, nothing.
Oh, tell them about this.
I've had a patient who told me, so platismal bands, we do them
Yep.
on both of you ladies. With some Botox, it's where we inject the muscles that run along like your neck to help relax it, smooth it, give a more youthful appearing neckline. I've had a patient who she bought off this Facebook group buy. She injects herself. She comes to me to do filler because she's too scared to do that. Thank God, because God only knows what she would be putting in her face. She was like, you know how when you do the platismal bands, like it's really hard to swallow afterwards? And I'm like, no,
that shouldn't be a thing.
that is. When she told me that as I'm injecting her lips, and I'm like,
Oh, God.
I didn't even know what to say after that. I was like, you need to be really careful. Like, you should not be doing that. You should be seeing a medical provider. Like,
Oh my
it's
God.
terrifying what people are putting in
terrifying.
their face.
Well, that's even like having
Yeah.
the dentist offer Botox. Like, I get that you understand the anatomy of the face, but this is not something that you're doing regularly to really understand the effects of where
Right.
it's going to go in the face. Did you learn it on a weekend, like at a dental
You also
seminar?
don't have time for like patient management.
No.
Like,
Yes.
Right.
Like, I can't get in for an appointment for like 8
Yeah.
months if mine gets canceled. Like, what do we do?
I was
Right.
gonna say,
I think we
Right.
concentrate on getting people in for cleaning.
Yeah.
Stay in
more
your
than
lane.
Botox.
I've had
Stay
a
in your
patient who her husband is a doctor. He's able to buy Botox. He's able to do it for her. She's like, nurses just do it better. So
They do.
she still
There you
comes
go.
to see me, like, even though her husband could do it for,
Yeah.
you know what I mean?
I tend to
less-
argue that nurses do it better than plastic surgeons.
We're
I do.
In
We are
dental.
gentler.
You're gentler. Well, plastic surgeons are used to you being asleep. And so I was in my primary injector a long time ago was a plastic surgeon. He was rough.
Oh, yeah.
Oh, that's
yeah.
a big
Rough.
thing.
That
yeah.
is-
and
yeah.
and not just because he was a guy, but he was just like boom, boom, and like no breaks. No, like you ladies are like breathe, you know, like And like half the time, I don't even know the needle's going in my face.
Well, and that's the bedside manner of being a nurse, right? Yeah. Or even when you go to, whoever your practitioner is. I much would rather see a mid-level, right? A nurse practitioner or PA, because their bedside manner and understanding your needs and wants are better than the actual physician who's just like trying to like pump through patients, get things done. I learned what I learned 10, 15, 20 years ago, and I don't really care to learn anything else new. Right? Where your mid-levels and your nurses, they're constantly trying to get more knowledge and understand like our bodies. Like we're figuring out, especially all these new things we're putting into our bodies, right? Yeah. This isn't 1980s healthcare, right? This is new stuff that we're doing. Right. So how are we responding to it?
Agree.
Right.
Yeah.
I agree.
Yeah. So those parties, beware. I mean, we have been in situations where we've had to report people because they are
how they're
claiming
advertising.
How they're advertising. And that hurts the integrity of not only injectors, but our whole industry.
100%.
And it just puts a black label on that. So I mean, I have so many feelings about that. But
I agree.
You should just be aware, because you don't know what shit is going in your face.
No.
And it could literally be shit.
Yes.
I mean, I always tell a patient, and I know Taylor and I both, like, when we're bringing products in the room, we bring them in closed, sealed to show them. If a patient ever asks to see, like, the vial that we're utilizing, we could go
grab
in,
it.
go grab it, show them exactly what we're doing.
But if someone's giving you a fuss about showing them the product, or that, you should be worried. You should be worried.
Yeah, red flag.
Yes.
And if your Botox is cheap, you probably should be aware.
Yep.
Right?
Yep. People are out there selling it for less than the price it costs for us to buy it.
Yeah, I don't know how they do that.
That's crazy.
It is crazy because it's not real Botox. So
right.
It's scary.
I mean, there's stuff like that just blows my mind.
Extra saline in there.
Extra saline.
Yep. Watered down. Yeah.
It's frightening.
Well, I feel like that's what's always a nice advantage of working for a business that has a good reputation too. Yes. Because we're also able, at the end of the day, like, what would Taylor and I have to gain from using a product inappropriately?
A mad patient,
Whereas if you're injecting door to door, like, that would be a huge advantage to you too. Just use a cheaper
and in
product
a small town like ours, word of mouth is everything.
Yeah,
and so is your reputation.
Exactly.
Right.
So, yeah,
it's true.
Where's the oddest place that you've asked to be injected, or someone asked you to be injected?
I have had, there's this new trend going around. It is like high heel Botox. I've had a patient ask me if we did Botox in the sole of their feet, so it would feel more numb when they're wearing heels. Apparently that's a trend. I've never heard of it. So
really?
That's probably the weirdest thing I've ever had.
I think
I've never heard of it.
What'd you say?
Oh, I was like, no, we don't do that. No, I don't want to mess with like the soles of the feet. I mean,
there are a lot of nerves down there.
Yeah, I know.
I can't imagine that would feel great.
No,
I know.
And I mean, we do like the palms of the hands or like the armpits for hyperhidrosis, so excess sweating. So like I could see it being something very relatively similar where we go superficial. However, there is a lot of risks because there's muscles, there's nerves. So like I would just rather stay away from that.
Yes.
So.
Yeah. I had assisted, I think it was within like my first 6 months. So if there's ever anything really out there, I'd have to find a friend. When I first started, and a woman was getting her calves done because she wanted them less bulky.
I forgot about that.
Yeah.
That is
Wait,
a
so
thing.
explain, I guess, so you would inject Botox to make your calves less bulky?
Yeah, I mean, it's not something that we would probably do, and I never saw the after results of it.
Got it. Okay.
But yes,
it's a lot of Botox.
I guess in a muscle, in a muscle that large, because you've got to figure for our masseters, we're doing
20 on
each side, let alone a
but
calf.
I want to have muscular calves. Like, I think it's sexy, like, if I have a pair of wedges or heels on.
And you can see the muscle,
and you can see, like, it's, like, thin from my ankle, and then you can see my calf muscle.
I think it was a little more of a cultural decision. Yes, if I'm remembering right. It's been a long time. But
I mean, Botox is used for a lot of therapeutic treatments. Randy used to run the therapeutic
like patients
arm
with
of
contracted
Botox.
arm. Like, there's a lot of pediatric patients that will get it.
For cerebral palsy. For your legs, it's tons of hundreds of units in your legs to help your muscles relax so you can walk straight.
Okay.
Or for what is that called when your face droops?
Ptosis?
Yeah. Yeah.
Or like
so
the Bell
like
palsy.
it's like Bell's palsy,
yeah.
and you can get it so it like
kind of
goes
even
back
things
up. Like
And,
so.
like bladder leakage.
Yeah,
Yes.
bladder
So,
leakage,
yeah.
Okay.
migraines, you know. So a lot of therapeutic use, if it's used in the right way, from the right injector, dosed correctly,
Yeah.
all of those things have to happen.
Definitely. And those are definitely where we'll always recommend, like,
Go see a neurologist.
see a neurologist.
Yes.
Get that covered by insurance. That's
Yes.
so many units.
So
like,
many units. I mean, under the arms, we do under the arms.
Yes.
Yeah.
How many units?
100 usually.
Yeah.
50 on each side.
It's a lot.
We can always go up too. I've had people go up. So
Wow.
Yep.
But it's such a life changer.
it is. A lot of people think it's
Well,
worth
especially
it.
if you're someone who gets like that yellow, like hard crusty in like your clothing.
Yeah.
You know?
Yeah.
I mean,
know.
my daughter, when she was in high school, used to get Botox under the arms every 3 months.
Yeah.
And she would still sweat through that.
That's crazy.
And she would wear sweatshirts, even in the summer,
Poor
just
girl.
because she would be like, but then she ended up getting mirror dry.
I remember
that-
you saying that.
What is
That's
that?
crazy.
A laser that takes away your sweat glands.
Oh.
Yeah, it was
I know. I'd
intense.
never heard of that
That's
before,
crazy.
It's
but
intense. But anyway,
That's
she's
really
better
cool.
now. Yeah. So we talked about earlier rather than later for prevention. What if you have somebody that comes in and they're, I don't know, 50s, 60s, never done anything? Because I know you both have had this experience. What is
Yeah.
that conversation like?
again, I feel like it's what specifically bothers you. What are your goals? If it's anti-aging, we kind of do a full facial assessment and kind of go from there. But everybody looks so different at every age. You know what I mean? I could have a 50-year-old who looks like they're in their 30s, and it's like, oh, we just need to do some preventative Botox and maybe some Sculptra. And then there's some people where it's like, okay, we definitely have like more work to do.
Well, because they probably worship the sun.
like the 70s.
We definitely have more work to
baby
do.
oil.
Taylor puts on her hard hat. Let's get to work.
No, but people usually, I was going to say, it's such a confidence boost. I feel like when they get treatments done and things like that. So people are definitely willing to put in the work and the effort into their skin and their face. So
Yeah, I think it can be quite a shell shock, the costs of the industry.
Yeah.
I don't think people realize like how small one syringe of filler is. Like, it's,
Yes.
they always compare it to the size of a blueberry, like just one. And the companies, which we always like grain of salt some of the
Yeah.
stuff, right, when they're selling things, but they do say like a syringe of filler per decade of life is kind of an expectation. So I feel like we try to do a good job of these consultations of like laying out exactly what we want their game plan to look like, and do we do that over the next 12 months? Like, how do we chip away?
Yes.
Like, because I think a really valuable piece of advice we were given is just don't assume where people place their priorities.
For sure. Yeah.
Because this might be top of the line priority where they are willing to spend the money, or it could be like fourth in line. So they
Yeah.
had to be a little more strategic. But I think that's a tough thing for us to overcome in our 20s.
Yeah.
Just like getting
Yeah.
set, getting developed and where we're at and budgeting our own lives, that it's sometimes hard. We're like, this is expensive, but you don't need to tell them your feelings.
That's
on
such a
the
great
price.
point,
Yeah.
because it is some people budget their money differently, right? And their
exactly.
priorities on where they spend their money are and we don't need to know how.
No.
Yeah.
exactly.
Right? So it is a different game where I know if you're not regular nurse, but if you're a nurse out in the wild
Yeah.
and not in aesthetics, sometimes you're trying to, for cost savings wise, you're like, okay, well, let's do this for this. We'll make sure we write this prescription
Yep.
so that your copay is cheaper or whatever. And for our industry, we tend to look at things like, what is it that you need in
Yeah.
your life, regardless of payment, I
Right.
guess, right?
Right.
Which is different.
Yeah.
It's a different way to
Definitely.
look at things.
Definitely.
Glo Medical Spa is Mid-Michigan's premier med spa for skin rejuvenation and anti-aging. The trained nurses and estheticians at Glo specialize in non-invasive facial aesthetics such as toxins, fillers, and lasers. Glo is ranked in the top 1% of all providers in the U.S. for Botox and filler, as well as Black Diamond Icon status for Hydrofacial.
Glo Body specializes in body contouring with Ensculpt Neo, Emcella, weight loss clinic, and therapeutic massage. Book an appointment today at glow-skinspa.com.
So what is your favorite procedure to give to someone? Each of you. Like, what's your favorite to do?
Mine's Sculptra.
Okay.
I feel like I love the science behind it. I love the results behind it. And I also, my nursing heart also appreciates that there's really very low risk for like vascular events. So you're, not that you're like free-willing it, but you're not like clenching your booty quite as much while you're doing it, right? Like, so you feel a little bit safer with that treatment, but we know like it's so results driven, right? Like, and we can treat the whole face, and that's what patients love about it. So, and starting there before doing filler, like it just gets you so much more bang for your buck, it seems.
Yeah. I agree. I feel like I really like that treatment for sure, but probably my favorite treatment to give people is Botox or Dysport, just because like the results, even though they're not immediate, like once they come around in 2 weeks, they look so good.
Yeah.
So I feel like that's always something, is it's like a nice satisfying treatment. Same thing with like lip filler. I feel like it's immediate gratification. So it gets people really excited. Obviously Sculptra is wonderful, but that one is a waiting game. So but no, I like all of our injectables, to be honest. I feel like I wouldn't ever.
Yeah, we believe in what we're injecting.
I think that's. I wouldn't ever put something in somebody else that I don't wouldn't put in myself. So.
Exactly.
Well, it's funny. So when I had my lips done, I'll never forget. You're like, these are so great. These are so beautiful. And I hold the mirror and I'm like, like you're nervous at first because you look different, right?
I feel like a lot of people aren't expecting it, even though it might not look like different, like by much. It is. It's a shell shock. I always tell people, you're going to be like, what did I let them do to me right away? But
I would say within a couple of hours and having like
once
ice on my lips,
goes down,
then I was like, okay, now I really like this. And then a couple days go by and more swelling goes down. You're like, damn it, I wish I got them a little bit bigger.
Right. Done more.
You know,
that is always the sentiment for sure.
So, and I think the biggest fear for the lips, and it was for me, that it was going to hurt.
Yes.
I'm telling you right now, compared to Moxie or anything else,
Agreed.
Get your lips done. By the time you have the numbing cream on, it's like popping a little pimple on the edge of your lip. Is it comfortable? No. But get the lips. I'm telling you.
Exactly.
You're not going to regret it. And don't wait until your face ages and your lips curl up inside of your mouth, right? Like
stretch that tissue out now.
Yes.
Let's talk skincare. Ooh. I know you girlies are big skincare fans.
Yes.
Okay. Tell us the difference. First of all, for those who don't know, the difference between medical grade and Sephora / everyone else. Skincare.
Yeah, so that's going to be like your active ingredients, your percentages that you see on these bottles, the ability to just go on Zio's or Skin Better's or Lassen's websites and see this is exactly what's in my product. I can research exactly what this is going to do for my tissue. Retinol is always a big one I tell my patients, because do you have to get medical grade skin cleanser? There are over-the-counter products that do a good job. Yeah. Retinol is always my heavy hitter, where I'm like, they're going to charge you an arm and a leg for a drugstore retinol.
That they're putting filler in.
Yes, like it's not going to be an accurate percentage of what's on the bottle. Whereas you get your heavy hitter Zio, Skin Better, you're gonna know when you put that on your face that you have bang for your buck with it. Where you might need 4 pumps of a moisturizer from Sephora, you use 2 pumps of Daily Power Defense. Like, they are not cheap up front. I'm never gonna lie about that. But what we're doing now with medical grade skincare is going to help you in 20 years, where what you're doing now with your Neutrogena moisturizer, it feels nice in the now. It's not doing anything for you.
Exactly.
Well, and I think a lot of people notice the difference. Like, the biggest deterrent is cost, right?
Always.
Typically.
Yes.
But after using it for a month, 2 months, and you start to notice the difference and that feeling of a fresh dermaplaned face.
Yeah.
And then you use your good skincare. Oh, just the way that your makeup lays on your face.
Yeah.
And you just feel so good. And listen, I'm totally guilty of trying to get rid of the peach fuzz on my face and just buying those little dermaplane things like at the, the drugstore. And sometimes I look like I got into a fight with one of my barn cats. Like, I don't have the skill of what it's like to have an actual scalpel in your hand and someone taking the time and having the training to shave your face.
Well, and it's like the strokes are so small.
It feels so lovely.
Right?
So I was shocked by this, and I didn't realize that you had to, and I'm probably the only one in the world that knew this,
but I didn't know that you had to have like a medical license for your facility to do an actual dermaplaning, because you'll hear things called dermablading, or so they're not actual scalpels. Because I had gone in to someplace back home, like before I had gotten married, and I just remember going from that and then having someone else do an actual dermaplane, and I was like, wow, this feels so different. My skin feels so different. You don't get actual dermaplaning with the scalpel.
No, you're getting what I get, those little like disposable
the
ones.
tinkles?
All you're doing is taking off the peach fuzz, and that's what I'm doing. You're not getting that layer of dry skin.
Yeah.
Right.
Yeah.
You know what I mean? And yes, those light feathered strokes.
Yeah.
So if you've never had real dermaplaning before, I say
You need one.
have
You
to
need
get
one.
it
Yeah.
done.
And no, your hair does not grow back thicker.
No.
Yes,
It does
that
not.
is a
big
crazy myth that
myth.
everybody. Yeah.
Everyone's terrified.
Well, because someone's grandma or mom told them that about their legs or their hoo-ha or something like that. It's like, no.
Not true.
I don't want hair anywhere except for my head and my eyebrows. That's it. That's the only places I want hair.
Exactly.
So
Exactly.
now you know.
Are we watching Love Island?
Yes.
I
I
mean,
feel
usually
like
up to date, but
the internet is obsessed with it. I feel like I have to like get involved.
I do too. My kids are obsessed. So I just spent the weekend with my daughter, her boyfriend, and then our other daughter, Randy, the 5 of us, all weekend. And these kids had to get back at night to watch an episode of Love Island.
It's every night.
Every
it
night.
airs every single night.
Really?
I'm not kidding.
We would
For like
be out to
6 to
dinner
8
and they'd
weeks,
be
I
like,
think.
all right, we got to go back because we got to go watch
Yeah.
Love Island. I'm like, oh my God.
Okay, so what's
Randy-
the draw? Like, what do you
I
think
have no
is
idea.
like
What
pulls
is
you
it?
in?
The drama. I was gonna say, I feel like it's the drama like that you don't have in your own life. I don't know. I'm a reality TV girl, so like if I'm being honest, like I don't know. I just love it. Like
How do you compare it to like Love is Blind?
it's way different.
Really?
So much
It's way
different.
different.
Yeah.
Okay.
I was gonna say Haley was
I can't
roped
get
in
into
by,
Love Island, but
No.
I love Love
I will
Island.
say this season, I won't lie to you guys. It's not a good season.
Evie said it sucks.
It sucks.
But she's
So-
still really into it.
Yeah, I was gonna say I'm not gonna lie. I'm still watching.
Yeah,
it.
the
well, I think that's
algorithm.
like us, like when we were obsessed with Housewives, right?
Yeah.
Like you're
Yeah.
like, you guys are boring me and this is
Yes,
stupid, but I'm still
yes.
gonna
I'm
watch.
still now I gotta watch
Yeah,
it.
it's everybody's in bikinis all the time. They're always outside. They're
Yeah.
Where
trying
is
to
it filmed? Like on an
Fiji.
island? Oh,
Ooh,
Yeah,
that's
I
nice.
know.
Okay,
I
I have
know.
a question.
Okay.
Is the trending like TikTok, Instagram sound where she's like, I'm a mommy.
Yes.
I'm a mommy. He's like, Mamacita. And she's like,
Oh yeah,
I'm a mommy.
I wanted to do an Instagram reel to that one.
Yeah.
I don't know what.
Wait,
but
is
I
that
do.
from Love Island?
Yeah.
Yes,
it
but
is.
it's funny because obviously she's trying to hint a secret.
Yes.
And the guy is not catching on. And it's
What was
really
the
funny.
secret?
that she's
she's
a
a
mom. That she literally is a mom.
Yeah.
and has a daughter. I think he was just
Why
like,
is she
what
being
the
on
heck?
Love Island?
Girl.
Yeah, I know.
Priorities.
I think I feel like she's. I don't quote me on this. I feel like she is probably one of the only ones that's a mom on that show because it's definitely
Thank
a lot of
God.
like. It's definitely a lot of like younger, like
Yeah.
Like 20.
yeah. She's
I guess
still
you can
really
be a
young. I
mom,
think
but-
she's still like 22 or 23.
I mean, well, first of all,
Still
do you really
baby.
want to leave your baby for 6 to 8
That's
weeks?
true.
So
That is a
you're
long
chasing
time.
fame
You know-
because you're not really looking to fall in love.
yeah,
You're
that's
looking to be
true.
Instagram famous.
Katie's dropping truths right
Yeah.
now. You're not
You're
wrong.
not
You're
wrong
not.
with
Yeah,
this
yeah,
show.
I mean-
whereas Love is Blind, I do feel like most of the
I
time
think
they
sometimes
are.
people
they're
really
older.
are
Yeah.
trying to find love.
Yeah, that's true.
They're
That's
older.
true.
Where is the next season of Love is Blind? Do we
I
know
don't
this
know.
yet?
Didn't we think they were
No, I
filming
think
in
it's in
Detroit?
Colorado.
I thought
I don't think they were able to.
I don't
It's
think
the
they got enough.
Midwest. I don't think people want to be on reality
I agree. I
TV
think
like
it is
that.
Colorado. or
Yeah, we
Utah
just
or
let them watch
something.
the others.
Yeah,
Yeah.
we do.
Yeah. Yeah.
We're obsessed with the others.
Yeah, I think they like let it out. Like it's
Man.
Colorado.
Yeah, I
I
think
think.
you're
right.
Yeah, which
I
would be
can't
funny because
wait.
you're getting a bunch of tree huggers, which I think is going to be interesting.
Or skiers.
Or stoners.
Yeah, maybe.
Stoners. Definitely
It'll
all
be a good
stoners.
season.
Yeah.
I feel like it keeps
Yeah,
getting
it's gonna
better.
be great. But
Yeah.
I might have to get into Love Island because
should.
Evie told me to watch
The UK
season
version's pretty
6
good.
first.
Yeah.
Oh, is that okay?
Love
She said that
Island
down.
USA season 6 is really good.
All right, I can
Okay.
give that a go. I feel like I watched the
That's-
first episode of the season and I was like internally cringing so hard. I'm like, I cannot.
Yeah.
Is that how you girls dated?
No.
Did you guys meet your spouses on the apps?
No, mine's
No.
in high school.
Okay.
Yeah.
Mine was like around town and then at work. So
Okay.
like I was like, oh, I've seen you before and you're cute. And our friend hooked us up. So,
Okay.
yeah.
So the traditional way.
Yes.
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 Yeah, we always joke that we'd have no clue how to date and
Yeah.
this time.
Right.
So
Since both
I've
of you,
been with Brandon now for like 12 years. So we're just, and some of like our siblings, and we're just watching. We're like,
Yeah.
that'd be so hard.
Yeah.
It'd be
Yeah.
so hard.
Well, like I have friends on like their second go around, right?
Yeah.
And then there weren't apps the first time they got married, and there's
Right.
apps now, and just navigating all that. No, thank you.
That's how my best friend met her husband, though.
I
They're
know.
No,
still
I have
together.
success
Yeah.
stories
Yeah.
for sure. I know people who have success stories, but, then
people
gotta
aren't
get
on there
through
for
a
the right
lot
idea
first.
or right
No.
intentions.
Well, it's like these
Yeah.
reality, like
Yeah.
Love is-
Island.
Love
How
Island.
old
You're like,
would that
why are you
statement just
here?
sound?
Yeah.
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 Yes, exactly. What are your intentions?
Exactly. You can tell they're playing a game this
Yes.
season for sure. Like they just want the money. So.
Oh, there's
Oh,
money
is there a prize at the
Oh
end?
yeah, there is.
Now that I'm into it.
So the couple that wins.
So now they're competitive.
Yeah, the couple that wins. I think it's 2,500.
25
Or I'm
bucks?
so sorry. No, $250,000.
Okay.
I think.
But they have
That
to
or half a
split
million.
it?
So it's one, they do like a drawing. They have to pick an envelope, and one of the envelopes wins.
Okay.
And they get to choose if they share it or if they split it with the other islander they won with.
Oh.
Yeah.
Oh.
Yeah.
So it's really an individual competition.
Kind of.
You could be
yes,
in
but
it
you
just for
also
yourself.
you could get to the end and you might not pull the right envelope, and if the other person doesn't want to share it with you, then it
I'm
doesn't
kind
matter.
of into it now.
Okay, so is one of the envelopes just say loser?
I think so.
Okay.
It's what I was gonna say. I think so. I usually
Just
just
be
like skip
empty.
to the end. The last episode.
No,
the last episode. I don't need the recap. I just want to know
Yeah.
who wins.
Right.
Right. Or I'll do that
Okay.
with Love is Blind when they're the couples
yeah.
I'm uninterested in. I'm like,
Yeah.
you guys bore me. I will
Yeah.
fast forward.
Yeah.
Okay, for Love is Blind this last season, the couples they were very polite. Don't you agree?
Yeah.
it was a
Yeah.
It was
great
boring.
group, actually.
It was great,
You're
but
kinda
I know,
not
but
good
we
for
watch
television.
reality TV for the
But yeah,
drama.
reality.
true.
It wasn't.
Well,
reality.
it would have been good if that one gal had gotten picked. I can't even think of her name, but the pink hair.
Yeah.
If she had made
Yes.
it through, it
She
would
was
be
the
a
shit
hot
stirrer
mess.
of the
Yes,
group.
Yep.
and she didn't make it through, so that's why she was
They
the one.
sniffed it out.
Yep.
Yep.
It's true.
But it would have been better television.
Oh,
yeah.
absolutely.
Oh, for sure. We said the same thing. I'm like, darn it, like.
I know.
See, that might as well have been a Midwest one.
Yeah.
because
Yeah.
They were just.
Yeah. I don't know any
happy-go-lucky.
other good reality shows up right now that I'm interested in. So I think
Yeah,
Love
I've given
Island
up on
is
Real
gonna be
Housewives. Although I may watch the new season of Beverly Hills just because I used to love Rachel Zoe, and she's going to be on now. But
Oh, she is.
well, yeah. But the tea is that she got divorced, and in her divorce, her brands are starting to fail. Not fail. I shouldn't say they're failing. But you know, she used to be like this high ticket item, right? As a
Stylist.
As a stylist. But now you can get like Rachel Zoe stuff at TJ Maxx.
Oh, yeah.
You know what I mean? So I think she tried to do like the big box thing,
Yeah. She
and it
jumped
ended
the
up,
shark.
you know, yeah.
Plus she weighs
deflating your
15
plant.
pounds.
So skinny.
She looks like one of the Olsen twins.
Do you guys
At
even know who Rachel
55
Zoe
years
is?
old.
I know the name, but I don't know what
She's
she looks
older.
like.
Yeah.
Yeah.
She's in her
In the
50s.
early 2000s, she was like everybody's best friend because she was their stylist. And
Okay.
if you were styled by Rachel Zoe, like you had the ultimate style.
Okay.
So I would watch her reality show like when Kylie was like 3-4 years old.
I didn't know she had a reality show.
Oh yeah, it was
I never
great.
saw it.
And and I lived in the middle of the woods, and we'd be like snowed in.
Yeah.
And Kylie and I would play Rachel Zoe, and we would go
Oh
in
my
each
God,
other
that's so
closet and like
funny.
put looks together.
Oh my God,
right.
that's
So,
so
of
cute.
course Kylie would look darling. She'd put looks together, and it would be like the highest heels in my closet
Yep.
with like leggings. And like, you know, I don't know, a bra.
Yeah.
And like 9 necklaces. And
Right,
like,
right.
Looks good.
It's good, Mom.
That's
yeah.
so cute.
So, we would play Rachel Zoe.
That's awesome.
So-
Well, you ladies are amazing.
Yes.
You do amazing work.
Well, do you have
come
any
see
questions
them.
for us?
Yeah.
Oh my gosh, I didn't come
know.
prepared.
Oh, it's okay.
I know.
It's okay. You don't have to.
prepared anything off the cuff.
Wasn't there something you were going to tell us?
Oh, yes.
Oh,
you said you had
yes.
something.
That's my
to-
final question.
Yeah.
Okay,
That's a good
well,
one.
we talked about it a little bit before the camera started rolling, but I get a text message late last night from Meko's daughter, Evie, and she's like, hey,
Oh.
by the way, I put you down for a reference. I want to adopt this dog, and it's like half what?
Pyrenees.
And half
English cream golden
yes, but you
retriever.
already have a cream golden retriever. And I'm like, oh my God, I love this. Of course I'll be a reference. And I love that you're doing this right before you go away to school. I'm thinking, there's no way Randy's on board for this.
He's not.
No.
She just sent it.
I know, it's just Evie. She just winks her way through.
Yeah.
She's like, all right, what do
He's
you...
not. But if a dog shows up at our house,
He'll take it.
Yeah,
Can
he's not
you
gonna
he's not going to
do?
say no.
No.
I know, but it
So,
looks like you have to
yeah.
go down to Ann Arbor and get it. She planned on getting it this Saturday
don't
when
know.
you go
That
to...
makes sense, though.
Makes sense. Totally makes sense. She will zip down to Ann Arbor anytime.
So
Anywhere.
congratulations on your new dog.
We'll see. Her name's Sydney. And
Okay.
Evie got the picture last
Sydney
night.
and
She's
Callie,
showing our
that's
current
cute.
Callie.
Yes.
Or our current dog, Callie. And she's like, Callie, you want to meet your new sister?
Oh my gosh. I don't know. I kind
I
of
don't
feel like
know.
Callie likes being an only
I
child.
think she does.
She's
a
a
good
She is
girl.
such a good
She's a,
girl.
she's a good girl.
I
but anyway,
know.
we'll see. I don't know.
And then, well, I have one more question for you guys.
Okay.
Do any of you need a kitten?
I've already told Brandon that the only way that we'll ever have a cat is when my child asks me for one, because I'll never be able to say no.
Has he ever
Okay.
seen a cat?
Yes.
Okay,
okay.
I have lots
I
of
wasn't
kittens
sure.
at my house, and they need a new home. So, you should probably bring your child over.
I
Do
know.
you need a
He
cat?
doesn't speak much English yet, so we're in the clear.
I have two big
like,
dogs.
Okay.
I don't know how they would react, honestly.
Bring them over.
I think Charlie would probably eat it, but
Yeah.
but for fun.
But for fun.
So, I mean, we live
love
out
cats,
on,
though.
I say farm. We call it our farm.
Yeah.
They've been brilliant with, mice and chipmunks and moles. So,
You should have brought them on, and we could have done like
That
a
would have been so
adopt
cute.
a kitten. We
know.
could have
Oh,
given
yeah,
them
you
each a
should
name.
Yeah.
Although then
That's
they'd
a good
become an
idea.
indoor cat instantly.
no, but then you got to worry about people who have allergies.
Oh, that's true.
You know what I mean?
Yeah.
That
That's
is
why they
true.
don't come in my house.
Yeah,
Because
that's
I have too
fair.
many family members who are highly allergic.
Yeah.
But
Or they claim they're highly allergic.
oh
Like
no,
Randy.
like Lisa's husband Casey, like he'll come in our barn within 10 minutes. His eyes are like
nuts.
swollen.
Yeah.
My mom,
no.
like, and Gunner loves the kitten so much.
Yeah.
And then he gets like this weird hoarse cough because he can't breathe, but he still wants to like hold all the cats. And I'm like, okay, let's put him down. Let's go outside. Let's take
Yeah.
some deep breaths.
Sweet Gunner.
Yeah.
Let's get you an inhaler.
Yeah. So,
Aw.
well, thank you so much for coming
thank
on,
you guys
you
for
having
guys.
us. This was
Thank you.
fun.
Everybody can find them at Glo.
Yes. Highly
see us.
recommend both of you. Love you both.
Yeah,
amazing.
thanks,
Thank
guys.
you.
So,
Thank you.
all right. See ya.